Welcome back, everybody, to Let's Talk About Sleep, the channel where we talk about all things sleep related. So today I'm going to start a new series of videos in the sleepy or tired category. Okay, and what that includes is fatigue, sleepiness, okay, narcolepsy, this condition known as idiopathic hypersomnia, and other things related to being tired, okay, or not feeling your best. So I wanted to start this video off with a discussion of fatigue, right? So before I get started, though, as I always say, please like this video, please subscribe to the channel. If this strikes a nerve with you or somebody you know, pass it on, share this with everybody you know, and when we get to 1,000 subscribers, I'm going to send one lucky viewer a signed copy of Let's Talk About Sleep. All the information is in the description box down below as far as how you can get my book and my social media and whatnot. Also, if you have questions, put them in the comment section. Once a month, I'm going to be recording a video where I answer all the questions, kind of in a conglomeration type of video. Okay, so keep an eye out for that. So let's talk about fatigue. Whenever we say somebody is tired, right, that has a couple different possible definitions, right? So somebody can be tired and be sleepy, meaning that they will fall asleep, right? They are falling asleep in class, they're falling asleep in meetings, they have their office door closed, they go take a nap. That's sleepy. Fatigue is a little bit different, right? Fatigue is I'm not necessarily going to fall asleep, I just don't have the energy to do what I need to do, okay? Sleepiness, there's a lot of different reasons for that, or I should say there's few well-defined reasons for sleepiness, but fatigue is a lot more nebulous. There's a lot more unknowns about fatigue, okay? And the field of sleep, the field of neurology, which I'm a neurologist, we don't really have a great understanding of what fatigue is, okay? And there's a new subfield of neurology coming out called neuroimmunology. And this is looking at how things in the immune system can affect how we feel, right? Fatigue is one of those things, right? So what causes fatigue as far as things that we know? Well, certainly anything sleep related, right? So obstructive sleep apnea, if somebody has insomnia, right? These two things can definitely cause somebody to feel fatigued the next day. But what else? Things like depression, right? Mild residual depression can definitely cause it. People who have significant anxiety, that can cause fatigue. People who have vitamin deficiencies, especially vitamin B12, right, B6, things of that nature can cause fatigue. If somebody is, let's say, mildly anemic, right, women particularly if they're menstruating can have low iron levels. That can make them partially anemic, low iron. These are things which can make somebody fatigued, okay? So it's important when somebody comes to see me is to figure out, is this sleepiness or is this fatigue? Okay, because fatigue, I just listed a couple of reasons, but there's many, many others that we're not even, that are not very well defined. Things like Lyme disease or chronic fatigue syndrome, right? These are things in the rheumatological world, right, where we're not even sure exactly what you make of them. Things like fibromyalgia, right? So sleepiness, like I said, has very well defined reasons for that. Fatigue does not. Now, when somebody comes in to see me and they're fatigued, we're definitely going to do an evaluation, okay? Definitely some kind of sleep testing to figure out what's going on. But in many cases, we may not find anything, right? Anything wrong that our testing can see. It doesn't mean the person's making it up or that there's nothing really wrong with them. It's just that our technology and our diagnostic technology is not there yet to really have the answer for everything. So what we do in someone who has fatigue is we try to treat the underlying cause, right? If it's a vitamin deficiency, take care of that. If it's depression, take care of that. Sometimes we don't even have a defined wrong thing. So maybe in those cases, what we'll do is we'll just treat symptomatically. Okay, that's unfortunately sometimes the best that we have. Medications that we call either wake-promoting agents, right? Provigil, Nuvigil, or stimulants, like traditional Adderalls and Ritalins and things of that nature. Okay, it's not perfect, but it is something that can give these people some relief. So fatigue, I think, down the line, whether it be 20 years from now or so, I think we will have a better understanding of it, and there'll be probably different subgroups of it. But for right now, though, yeah, it remains frustrating for patients and providers too, who are trying to help these people. But if you do have fatigue, just know, you go see a sleep specialist, you may not get a well-defined answer. It may be, okay, it's not this, this, and this, but here's what we can do to help it. Okay, unfortunately, we do have ways to help it. So that's today's video. If you have questions or comments, please leave them in the comment section. The link to my I just dropped my mouse. The link to my book, Let's Talk About Sleep, is in the Amazon. The Amazon link is in the description below. And like I said, keep an eye out for this next series of videos about being tired. Okay? Until next time, sleep well, everybody.